It's a heart condition that affects millions of people, and it impacts more women than men.
The reason why isn't entirely clear, but starting this week, the CDC has a new way to track it in hopes of making it easier for doctors to diagnose and treat patients. In News for Your Health, we're hearing from a local woman who was diagnosed with CMD and the doctor who helped bring her relief. Selena Gore is the CEO of Women Heart, a national organization that promotes women's heart health, and says their message is simple.
We would love every woman to be aware of what the signs and symptoms are of heart disease and to advocate for themselves.
And she practices what she preaches, seeking answers to a medical mystery that impacted her own health.
I have been to the ER a total of 9 times over the course of the last 2 years. Each time I was sent home with really a less than satisfactory answer for what was going on.
Doctors ruled out a heart attack and stroke and ran a battery of tests, but still couldn't pinpoint what was causing the pain in her chest.
It was, let's just say, a really challenging 2 years of going back and forth to the ER, feeling like I just wasn't being believed that something was going on with my heart.
That changed when she met Dr. Haider Hashim, a cardiologist at MedStar Washington Hospital Center in D.C. Using new technology called Pressure Wire X, Dr. Hashim can zoom into the smallest areas of the heart to see what's wrong, diagnosing Selena with a condition called coronary microvascular dysfunction, or CMD.
Giving someone a diagnosis takes that emotional and psychological stress off the patient's shoulders.
CMD impacts 4 million people and is caused by decreased blood flow in tiny blood vessels of the heart, causing chest pain, fatigue, shortness of breath, and can lead to a heart attack if left untreated. And now, for the first time, the CDC has a new way to track the condition, creating a new diagnostic code to track CMD in patients here and around the world.
It's a very good way for CDC, by giving a designation, to track the condition, to develop treatment, to help physicians like myself to understand it, to look at the data and understand what medication worked, what medication didn't work.
For Selena, getting the diagnosis on her 52nd birthday was the best present she could ask for.
Dr. Haider said, happy birthday, you're not crazy. I just felt all kinds of relief because I knew something was wrong, and knowing what it was really a gift.
Thanks to the diagnosis, she's now able to manage her symptoms with medication while sharing her story, reminding women to take charge of their health and heart. And that is so important. Risk factors for CMD include diabetes, smoking, high blood pressure, and high cholesterol.